between us, we have many years' experience, around 30 years each in this field. And Dinesh, our main presenter, is an experienced physiotherapist and consultant for EMS Physio in Asia. Thank you. I'll be back later in the presentation for a demonstration of our EMS Primo shockwave unit behind me here. And finally, join Dinesh for the questions and answers. Some questions have been pre-submitted, so we will address a selection of these first, then open it up to the floor for questions before we wrap it up. I will now leave you in the capable hands of Dinesh. Hi, Dinesh.
Hi, Roy. Thank you very much.
You're very welcome.
Me today, and we're really excited to be on this session. We are still looking at participants walking into the Zoom meeting. Our registrations are close to I actually have crossed 500 over, but we see how many are going to turn up today.
It's a fantastic participation level. Thanks everybody for coming on.
Yeah, at the moment I can
still joining.
About 130, because we have to allow them a couple of minutes to.
Sure.
So yeah, I think that there's probably some traffic jam happening with so many people walking into here.
Traffic jam on the internet. Hopefully we won't get the gremlins. We won't get any internet gremlins either. So.
Yeah, so I can see the numbers are tickling through, and yeah, let's give about 2 minutes.
Absolutely fine. Yeah.
I think before, guys, those who are here already joining our session, please go through these instructions first. Shall I start the poll now? Those who are coming. Okay, guys, those who are already here, we will try to gather a profile of yours. I'm going to show a little poll on the screen, and we will really appreciate if you can feedback about these quick questions. Yeah?
That'd be really useful. It's good to see your comments coming in. Hi, everybody. Joining. Hi there. Hello to Norfolk. Yeah, people are joining thick and fast now, I can see.
Yeah, Roy, I will just give another 2 minutes and then we'll begin the session, yeah?
Absolutely fine.
I can...
This is great, people coming from all over the world. It's really good to see the participation level. Yes, good morning, good evening, good afternoon. What do you think, Dinesh?
Okay, I'm going to now start the session. I think while people will be still coming in, we cannot be waiting any longer, and we'll begin the session today. All right, guys, welcome everybody to this great session. We have all the people from different part of the world joining this session. And you can see, hang on. Sorry, just a little bit technical.
There we are.
Yeah. So here you can see the profile. We have people coming from United Kingdom.
Dinesh, I've got the window, the poll
so we're just
window.
shutting it down. Yeah, okay. It just propped up.
Yeah.
And so these are the countries people are joining us in the session. So guys, we had also given opportunity for you to put down some questions for this session, and we got a number of questions in those forms. And our observation was that many people have great need to understand the very fundamental and basics about shockwave therapy. And it is very obvious because there is so much confusion that is happening into the shockwave with different type of terminologies. Those are being used and with a half understanding. So I think let's be very clear about our objective for the session today, because there will be too many queries, there will be too many questions. We are starting it as a point where we can be on ground zero, and we want to understand what the shockwave is and how does it work, and then we build the momentum from there, right? So shockwave, as you may have read in different parts of literatures, we commonly use the terms ESWT, right? So ESWT is, which stands for extracorporeal shockwave therapy. Now, whether it is focused, and people hear about this called focused shockwave, there's a radial shockwave, there's a radial pressure wave, and different terms. And you see different applicators, as you see in the picture here, different type of applicator shapes and sizes and features that makes everybody a little bit confused. So if you look at the term, called ESWT, is extracorporeal shockwave therapy. That means this is produced outside the body. The waves are generated outside the body and they are transmitted into the body. However, if you look at two major type of devices, we call them focused and the radial shockwave. Both are considered as EWST, which is extracorporeal shockwave therapy unit. Some people are also using, to avoid the confusion between focused shockwave and radial shockwave, and call it as radial pulse wave therapy, which is fine and fair, which is also correct in its own sense. So what is shockwave? Shockwave is essentially a pressure disturbance that propagates rapidly through a medium. So for shockwave to transmit or to move the shock waves, it requires a medium. And the medium can be solid, it could be liquid, it could be gas or plasma. So the large amplitude, it is a large amplitude of compression waves. These compression waves are transmitted into the body. And when these waves are being transmitted, there is a transfer or transmission of energy that is taking place. And these transfer of energy is what creating the therapeutic benefit to the tissues. So if we look at, it is very interesting to understand where the shockwave came up from. To me, shockwave are probably one of the most innovative modality which has been introduced into physical therapy domain after many years. We had some currents, we had some other modification, but shockwave are very new in terms of technologies that were embraced by physical therapists. Now, if we go back into the history, the very first evidence of shockwave was noticed in the World War II, where when they actually found bodies of dead soldiers, but there were no wounds outside, there was no external wounds. But they found, when they opened these bodies, they found the internal organs have been damaged. And that raised the question in the mind of scientists that what is that is causing bursting of these organs and resulting into fatalities. And after studying, they found actually it is the explosion, it's the shock wave that transmits into the body and creating a rupture effect and causing the death. And that led to the development of what we call shockwave started using for lithotripsy. And this started in somewhere in 1970s and got quite popularized in 1980s. So some of you may think, okay, which is this shockwave? Can all the shockwave do lithotripsy? No, the answer is no. We cannot do lithotripsy with all kind of shock. These shockwaves are very highly specialized with a very high power and very high level of control and precision that requires you to channelize the energy at one concentrated point. So as you see what happens in this picture, the patient is lying down, the waves such are transmitted, and that actually helps in releasing the, hang on, okay. So that helps in basically bombarding the kidneys with the waves, which breaks the stones into small pieces and that get flushed out. Right? So what also was interesting was happening when you're delivering this shock wave, as you see in this picture here, while the focus shock wave are being generated, there were also spread of lower intensity waves around, which you can say kind of radial shock wave kind of effect. And it was also found that people who got exposed to these techniques were having some form of healing effects and some form of pain relieving effects as a secondary effect to the lithotripsy. And that raised the interest in the scientists to look and investigate further what could be done and how can we manage this in a more therapeutic way. And that led to the development of what we call musculoskeletal shockwave therapy, as you see here. Then this was the first kind of device that was introduced in mid-1990s, 95. And in 96, this machine was first introduced to the German team at the Atlanta Olympic Games. So this was one of the very first generation of musculoskeletal shockwave therapy. Now, in terms of shockwave, technically, they are the acoustic waves. Shockwave are the acoustic wave or the sound wave. And we are very used to using sound waves, sound therapy as ultrasonic therapy in our physiotherapy practices. But there is a big difference between a sonic wave that is used with shockwave compared to the ultrasound wave, which we commonly use in physio practices. As you can see here in the diagrams, the shock wave, the ultrasound is it is consisting of periodic oscillations, whereas the shock wave type of sonic waves are sporadic. They are single wave which are shooting high level and then taping down. So there's a basic, this is the basic difference in two type of wave, and their physiological effects are also very different to each other. So in terms of generation of shock wave, how they are generated, okay? If we look at shock wave, we can broadly classify them as hard shock wave and the soft shock waves. The hard shock wave are what we call is the focus shock wave. Again, the focus shockwave, they have three principles of generation: spark, discharge, piezoelectric, and electromagnetic. I won't go into all this detail, but what you can see here is, as you see, all the energies in the three modes are actually concentrated at one singular point, and this is very focused point in few millimeters of dimensions, whereas the radial shock wave is actually spreading out as it penetrates into the tissue. As it goes down and further, the energy levels go down and drop. Now, the radial shock wave are also developed by two different mechanisms. One is called pneumatic, where it is using a air compressor to actually allow the shock wave to be generated. The second mode is the electromagnetic technology that allows the shock wave to be produced. So let's look into the next slide, and here you will see the difference in the capabilities or penetration for two type of shock waves. If you look at lithotripsy, which is very, very, very high, we wouldn't touch much onto that. That's for the history. But if we look at the focus shock wave and the radial shock wave, you can see that the focus shock wave is extremely deep compared to radial, whereby we are looking at a depth of about 30 millimeters, whereas the focus shock wave will have capability to reach up to 50 plus 55 millimeters of depth. It is possible to move this level of depth up and down by controls, because you can target your tissue very accurately. Whereas in radial shock wave, we are actually losing the amount of energy as it is being penetrated. So the maximum energy is happening or is present at the tip of the applicator and on the superficial surface of the epidermis and beyond structures. And as we increase the power, it tends to go further deeper and deeper. So you can see here the classical pattern of two type of waveform that is generated. So this is your focus shock wave. As you see, the whole energy is actually concentrated at this tip point, okay? Because classically the shock wave focus started as more blasting effect for shoulder calcifications, or plantar calcifications and so on. So it started with the same thought of lithotripsy to create a kind of blasting effect. Okay, so we're channeling all the energy here. Whereas the radial shock wave is actually spreading out. As the energy is transmitted into the tissue, it gets spread out to the wider locations, wider areas, wider tissue. So you see the spread of the wave here is very different. It is more spread, more even. The pressure levels are significantly wide apart, and I will look at that in more specific detail in terms of its features. Comparing a focus with the radial shock wave, you can see the focus shock wave is working almost 100 times more pressure levels what a radial wave is doing. Okay. Now, it is not necessary to think and understand the more is the better. Not true. Yes, the more is better for certain condition, but it may not be better for all the kind of condition. And that is why in the later years, the radial shock wave has become more popular, because we need much more wider application of these devices. So if we compare focus versus radial shock wave, we know that focus carries energies level of 100 times more than radial, and its pulse duration, you can see again, focus has a much smaller pulse duration compared to radial, which is a wider pulse duration. The depth of penetration for focus is depth of penetration is focus. Sorry, it should not be large, it should be narrow. And for radial, the depth of penetration is shallow relatively compared to focused. and its energy is reducing with the depth. So effect of focus is more on cellular level that is happening. The physiological effect is on cellular level, whereas the radial is working more onto the tissue level of physiological effect. And this slide gives you very good explanation how these radial shock waves are produced. As you can see, we have two type of generators, we call them. One is compressed air generator. And sorry, give me a moment. Okay, so it's got a tubing and we have a ball as per se. So I'll show you. No, that's fine, Roy, not to worry. It's something like this. I created a little sample for explanation. So this is what is happening inside the radial shock waves. So you have this projectile. You can see this projectile is actually moved across. Yeah, you can move it across. Now there are two ways you can move it. One through the pressure, the force of the compressed air, the pressure goes in. The second is through the electromagnetic, as you say, by altering the polarity between positive and negative, the projectile is moved inside, okay? So the movement of this projectile is what create an impact onto the strike plates here. And this impact creates the force, and the force is then transmitted into the body. Now these projectile velocities could vary from 5 to 25 meters per second. Okay, so depending on what is the frequency levels we are selecting for device to be operating. So if you see these two type of applicators, as you see, this kind of gun looking is classically compressed air applicators. And if you look at single handle like this, these are your electromagnetically generated applicators. Okay. So if you look at difference between one more this. So if you look at difference between electromagnetic and the pneumatic, the principle of generator is different. As I said, one is generated by using air compressor, other is generated by using the electromagnetic principles. But in terms of energy measurement, also it varies. What electromagnetic is doing is actually measuring or delivering energy is millijoules or millijoule per square millimeter. Whereas the pneumatic devices are measuring the force in bar. Okay. In terms of having capability to do burst, it is possible with electromagnetic devices, but it is not easy to generate burst option with pneumatic devices. In terms of wear and tear, both devices, because it is projectile, which is actually moving constantly. Okay, the projectile is constantly moving. There is a friction, there is a wear and tear that is happening. The applicators, all applicators will require changes. And this can be varying from devices to devices. For electromagnetic, it can be from 2 to 4 million. It will require the entire applicator to be changed. For pneumatic, they will require the guiding tube and projectile to be changed. And at a later stage, the entire applicator gun need to be changed as well. So if we go further to the applicator, we also notice there are different type of applicator tips. Those are available. Now they have very, very important significance, and many of us tend to ignore. And we often see, you know, people using the device, they put the applicator on and the whole day they are using the same applicator. the whole week or even the whole month, they are using the same applicator. Now, if you want your treatment to be more accurate and you want your forces to work the way they should be working, you need to change the applicators. That's important. In terms of applicator sizes, for electromagnetic, we have 3 different sizes available. And I think almost all the machines which are electromagnetically generated, they offer the similar sizes, which starts from 6 millimeter to 15 to 25 millimeter of size. So if you have a 6 millimeter, now this chart shows you a very nice of amount of energy that is generated or delivered at different level of energy. Okay, so now if we look at, if you deliver 60 millijoules, 90 millijoules, 120 or 180 millijoules, or you call it 1, 2, 3 and 5 bar of pressure in those who are familiar with pressure levels, will find that there is more energy delivered with the small applicators. Why? Because your total surface area, if this is the total energy delivered over this area versus total energy delivered over this area, you will have more impact on the smaller applicator. Now, what is this 60, 90 and 20 millijoules of energy? This is the force that is being applied. Okay, that is the force. If it is 60 or go harder or you go even more harder, so that is the force that is being impounded onto the projectile. That in turn, with the weight of the projectile, in turn with the frequency, will result in what we call the total energy that is generated or delivered to the tissue. So this graph shows you how 3 different sizes of applicator make significant difference in total energy density. You can see the comparison of these. The red one is your small applicator that generate over 6 millimeter square centimeter, and you see the which is the middle size, and then the blue, which is the large size applicator. So now I think it is good to remember and think about changing these applicators while you are treating different tissues. So I go back here, this slide, you can see here, if you are treating patient with the tight and small areas as well as acupressure or trigger points, use the small tip 6 millimeter. If you are using for muscles, small tendon, ligament, use the 15 millimeter. If you are using for larger areas, soft tissues, plantar fascia, use the bigger applicator, 25 millimeters. So that's what you need to do, change to be having more effective treatment for your patients. So the basic of shockwave transmissions is you can run on continuous or you can run on burst mode. Burst mode is sometimes helpful when people are very apprehensive about subjected to the external force. They are in pain and we are bombarding them with some form of physical stimulation, some kind of pressure, and they don't feel comfortable. So the burst helps them really to get used to this mechanical forces, have them adjusted, and then you can proceed to the higher level or continuous level of waves delivery. Also, the frequency is variable. What is ideal frequency for what type of tissue? I think this is still a bit of question mark to the researchers. We haven't got the perfect answer. Why I put these 2 pictures here? Because I consider applying the shock wave, okay? Applying the shock wave is very much like you're drilling a nail into the wood or into the wall, right? So it is easy to drill the hole or nail it into the wood, then to the wall. And likewise, I think our tissues also vary in terms of their firmness, their thickness. The muscle tissue is very different from the tendon, and tendon is very different from the ligament. So I think this is important to really feel and experience what is the right frequency response to these different tissue, which is a question mark right now. I wish researchers will in coming time pay more attention to these factors. But again, that's in a way secondary. So so basically what shockwave is doing is very much you're drilling. Okay, sometimes you may be hitting fast with small amplitude, or you're making a big bang to hit. Okay, so it depends how somebody also tolerates it, how patient can react it, because the reaction of patients are also very subjective. Some people may be able to tolerate higher frequency and lower force better than low frequency and high force. Okay.
And obviously, sorry, and obviously the higher frequency, i.e. 22 hertz, 22 shocks per second, you will deliver the treatment much quicker than you would at a lower frequency.
Absolutely. So these are the things we have to keep in mind when we are dealing with patient, because it's very, very difficult to put down a standard rule. And also, Roy, the issue is when you go on higher frequency, the unit tend to lower down its force level, right?
Yes, yes.
It's not producing that. And I believe that is because same thing, when you're doing higher frequency, you're moving smaller distance of projectile. So the weight is not being dropped from that height. So imagine a weight drop from 1 meter versus half meter. The force is going to be different. So that's the difference when you actually change the frequency and use higher frequency, the power will somehow drop down. But what matters is actually the total energy that we are delivering. Okay, that's what body is going to be subjective, whether by higher frequency or a lower frequency. That is a little bit secondary at this point. So in the terms of energy delivery, as I said, I'm just putting a simplistic chart. Those who are used to bar or millijoules, they are actually comparable energy levels in most devices. I wouldn't say every device, but to my understanding, in most devices, yes. Because again, it will vary. There could be other variable components. So in terms of physics of technology, the therapeutic shock waves, we know they are acoustic waves and they require a medium for propagation. So what happens when these waves are transmitting into the tissue, there is going to be happening reflection and refraction. Okay, the acoustic energy is going to be reflected, it's going to be refracted. Now, while this medium density changes are happening, the energies are being released, right? So there's what is important is that maximum reflection and energy absorption happens at medium interfaces where the two different type of tissues are interfacing each other. That's important. And I think that's my understanding from this, that why shock waves are so much more effective in musculotendinous conditions, because likely there's much more level of energy transfer that is happening in two contrasting mediums. And as you can see in this chart here, there are difference in density, in the velocity of sound and the acoustic impedances. Okay, that will matter a lot in the amount of energy that is being transmitted from one layer of tissue to the another layer of tissue. So physiological effect of shockwave we can classify into three different types. It can create destruction of the tissue, that is very much practiced in focus type of shockwave. Increase healing, which is common to the radial and focus, and decrease of pain. So as we see here, when the shock wave are entering into the muscle and interfacing with the bone, the density difference is tremendously wide, and that will release lot of energy at this level. So in terms of energy classification, this is according to the ROMP, quite established researcher in this area, and this is more attributed to shockwave, which measure energy flux density. You can see the low energy is in the range of 0.08 millijoules per square millimeter, and medium is in 0.28 millijoules per square millimeter, and high in up to 0.60 millijoules per square millimeter. And you can see clearly in this slide that the low energy is responsible for cell repair and regenerative type of physiological effect. Energy level of up to 0.5 or 6 are good for pain therapy. For non-union, you need energy level close to up to 1 millijoules per square millimeter. And those are typically generated at focus level of shock waves. And for lithotripsy, you go even higher. So the energy levels are much variable, and that's how they are classified in terms of their physiological effect and therapeutic effect, how much energy to deliver. The biophysiological effect, these have been extracted from International Society for Medical Shockwave Therapy, which is the worldwide body of medical professionals which have been putting all the hard work for past 20 years and setting up guidelines, and they have excellent resources actually to look into that and find all possible answers. So they have recommended the biophysiological effect into these threefold major effects, which are mechanotransduction, and which is by altering the cytoskeletal and extracellular molecules. Second effect is via healing through neovascularization. And the third is other effects such as anti-inflammation, tissue nerve regeneration. So you can read more into the details in these kind of papers. In terms of applications, the International Society for Medical Shockwave Treatment has actually, in 2016 meeting in Italy, they have actually listed down these approved standard indication. When you call approved standard, they have tremendous amount of research evidence backing that these can be used, these conditions can be used for shockwave therapy. So,
and in the UK, sorry Dinesh, and in the UK we've got NICE guidelines as well for a lot of these indications.
The NICE guidelines, yeah, absolutely, which approves much of these as well. And I will not read all these because you can browse through them. What is important is chronic tendonitis. Most of these conditions for shoulder, elbow, greater trochanter, patella, and plantar fascias, both focus and radial shockwave have their advantages and their benefit in producing positive outcomes. The other approved standard indications are on bone pathologies such as delayed bone healing, non-union, stress fracture, avascular necrosis, and so on, and also skin conditions. Now, as far as bone pathologies and skin conditions of this nature is concerned, mostly the effectiveness is for shockwave focus nature rather than radial shockwave nature. As far as approved standard indication is concerned, research-based outcomes of these conditions. In terms of other applications, these are empirically tested clinical use, which have also evidence available, and such as rotator cuff tendinopathy without calcifications, medial epicondylopathy, and so on. For 2.1, I would say both radial and focus are useful. They have their own role in these management, but in bone pathology, bone related symptoms, focused are more effective in their outcome. The other applications are on muscle pathologies, of course, myofascial syndrome, muscle sprain, cellulite. All these 2.3 listed are very suitable for radial shockwave applications. And 3.1, which is classified as exceptional indication or expert indications, which include osteoarthritis, plant and trigger finger, Dicker vein disease, so on. Both radial and focus are being used. There is some new emerging evidence also is coming to neurological application of shockwave in terms of reducing spasticity, polyneuropathy, carpal tunnel syndromes, and also in urological condition. And most key is the erectile dysfunction. There's a lot of papers which are being published, but for urological application, it is recommended to use the focused shockwave. Not so much evidence on radial, though I see some people trying to use radial shockwave as well for these applications such as erectile dysfunction. But usually the delivery for such application is at very, very low energy levels, and the lowest energy level in some devices are actually still quite high for such applications, so that's not suitable. In terms of contraindication, these are the list of contraindication that we have to follow. Epiphyseal plate in the focus, coagulopathy, lung in the focus of the treatment, and the brain or nerve, pregnancy, and malignant tumor. So all these are contraindication we have to be careful while treating. In terms of research and evidence available, I would say there's a tremendous amount of research evidence that is now being generated. And lately, you will find a lot more coming. I pulled this specific reference very much because it's very powerful, which actually talks about efficacy and safety of extracorporeal shockwave therapy for orthopedic conditions. It's a systemic review, and it has actually used the database derived from PEDRO, which is pretty much golden standard for physical therapy database. So, which summarize that extracorporeal shockwave therapy is effective and safe, and the optimum treatment protocol for it is 3 treatment sessions at 1 week interval with 2000 impulses at highest energy that patient can tolerate. So I know probably you may have heard a lot of people saying, oh yeah, how many shock wave shots to give? 2000, 2000, 2000. What is the ground behind this magic number 2000 is right here. That's what is derived out of several research and findings. Also, it is important to see what I put down in red text here is there's no scientific evidence in favor of either radial shockwave or focused shockwave with respect to treatment outcomes. Okay, so that's a very powerful analysis and conclusion that both radial and focused are producing quite powerful and equal outcomes. But please get this very clear. We are only here relating to orthopedic conditions. We're not talking about all the conditions. We're not talking about like fractures or skin or urological conditions and so on. Okay. There are so many research which are available, but we are not pulling them out. But you see, this is latest research available in 2020. This paper, which has been published, it's a systematic review and meta-analysis. And this came out of Curtin University and the team which actually did this meta-analysis. It's a very powerful publication. You can refer it and you will see it has validated the effect of shockwave in the management of on the calcific tendinitis for rotator cuff, which actually is in line with the previous finding and studies which have been published, and also summarizing that it has got significant role in reduction of plantar fascia thickness as well. And another research that has come out in March this year is in the area of osteoarthritis. It's also a systemic review and meta-analysis, which conclude that it is highly effective in OA, in pain reduction and functional improvement compared to placebo, corticosteroid, medication, ultrasound, and so many other areas that actually it investigated against. However, the shockwave failed to show statistically significant difference compared to manipulation and surgery, which is understood. So as we look at conservative mode of management, it does stand out quite a superior technique to be managing and working with osteoarthritis cases. Okay. So in summary, we can look at focus versus radial shockwave, preference for radial shockwave, preference for shockwave focused, and for both recommendation, which actually I have summarized in previous slides as well. This is a classical result, study which is published in Journal of Bone and Joint Surgery. Also, you can see reabsorption of calcified tendinitis, but this result is out of focused shockwave treatment, which has been done over a period of 3 months. Complete reabsorption of calcification is noted here. Some of requests have been to really get some exact parameters and treatment parameters about conditions. So I have listed down here for calcific tendinitis, what can you do in terms of focus application and radial. For radial, we'll focus here energy level about 90 to 120 millijoules or 2 to 3 bar, frequency of 15 and pulses 2000. These parameters that I'm actually mentioning here are not just generated by my own thoughts, but they are based on ISMT's database that we researched and referred to as well. So I will not read through this because you can have your time to go through these. We will be sharing these presentation slides with you, which you can actually access and hopefully read through them as and when you need. So here we have protocol for epicondylopathy, and we have for greater trochanteric pain syndrome, plantar fascia as well. Okay. So I think we are really stick on to the time, and now at this point I would invite Roy to come and introduce some of the technique on shock wave and the device, how it operates. Roy.
Thank you, Dinesh. Thank you so much. If you could, thanks for that. That's great, Dinesh. Right, we have the EMS Physio 560 Shockwave right behind me here. What we have, Dinesh was talking about the method of transmission, the electromagnetic method of transmission. The projectile is obviously going down the barrel here and connecting with, and Dinesh was explaining them earlier, the applicator tips. There's a 6mm one. They just screw in. They're just interchangeable. Just screw into the applicator there. The handpiece, otherwise known as, there's a 15mm one. Just screw in. And I'll actually just screw in the 25mm one for the demonstration. Just easily screw in. Just threaded. Okay. And then a membrane popping on top. So there's two purposes, the membrane. First of all, it actually helps to dissipate the radial shockwave a little bit to make it more amenable for the patient, to make it more comfortable for the patient. And also it stops the medium, i.e. the gel, from getting down into the working. So we've got these, and it comes with all these. It comes with the 3-sized applicator tips we spoke about, plus it comes with a set of membranes to cover. So that's that. Our shockwave, as well as Dinesh was saying earlier, the electromagnetic type of shockwave is operated by a foot switch, which I've just got it here, which I'll pop it down on the floor in a second. Activate the foot switch to get your a number of shocks that you require. There's no trigger needed on the applicator. So your two hands are free just to apply the shockwave with one hand, and you've got the other hand free and available. What I'll do now is just go back to the screens on the shockwave unit behind me here. There is a setup video that I'd invite you all to have a look at. It's on our website, on the shockwave section of our website. It's just a short little 2-minute video that actually shows you how quickly it can be set up and ready to be treating a patient. But what I'll do here, obviously, I'll share my screen just to show you these screens here and explain the different parameters. Dinesh was going over them earlier, but obviously to explain those parameters in relation to the EMS 560. So if I just share my screen and go to my right, now this is the home screen. So I'll explain each parameter here. So first of all, you've got the global counter, the reset and the reset button next to it, if you wish it to return to 0. When you first switch on the EMS 560, obviously it'll be 0. The home screen underneath it will say the set shocks. So we've got 300 here, it's just a nominal amount, but if you press set shocks, you can then increase, decrease the amount of shocks you require for this treatment. Underneath the millijoules, now this is the energy, and underneath that, again, during Dinesh's presentation, he highlighted the energy density. And if you see the treatment tip that I screwed in, I happened to screw in the 25mm treatment tip. For 90 millijoules of energy, the actual energy density is actually highlighted underneath of 0.18 millijoules per millimeter squared. And the default setting here is 8 Hertz. On the right hand side of the screen, you've got the total energy. That will be across the whole treatment in millijoules per millimeter squared. And underneath the tip size, the good thing about the tip as well, the tip size button, is if you select that tip size, whichever tip you've got screwed in, then the machine will count how many shocks that tip has done, which is a really useful feature. But underneath there, you'll see treatments. And if I click that, I'll just go on to my next slide. You then get the preset treatment protocols that we've put in for you anyway. So we've put some evidence-based ones on the left-hand side there, but we've also put a set of user programs. So if you read a clinical paper, maybe on Google Scholar or on a electrotherapy website or whatever it is, you can actually then program in your own programs on the right-hand side there to have your own settings, user programs 1 to 8. But you can see the ones on the left there. On my next screen, I'm going to choose the top left-hand corner one, plantar fasciitis, and then just click this to show you. And this is what it would look like, a treatment suggestion screen. So this, the number of shots, Dinesh mentioned it earlier, 2,000 shocks, very popular for a shockwave treatment. Another little handy thing next to 2,000 shocks there is a percentage counter. So when you are doing treatments with a patient, you can actually tell the patient, because they might be quite nervous of the treatment or whatever, that you've done 25% of the shocks, you've done 75%, you're nearly done, you're on 90% of the shocks that are set for the treatment. So sometimes that's a good thing both for the therapist and the patient to know. Underneath there, you'll see that for this particular treatment suggestion, it says 90 millijoules, but again, energy density 0.18 millijoules per millimeter squared, because again, I've screwed in the 25mm applicator tip. And the actual treatment frequency underneath is set for 8 Hertz, which is set for that. But you can see as well, Dinesh was mentioning burst earlier. You can also set burst to set 8 shocks at a time, which is quite exacting when you're treating quite a patient that might be nervous about the treatment. And then once a patient becomes fine with the treatment, you can then switch off burst mode and then do a continuous frequency. The user-defined program screen is the next one. That is where you will then just set up your shocks yourself. Under user program number 1, for example, you will do, it's just nominal here, so it says 1,000 shocks, 60 millijoules or 0.12 millijoules per millimeter squared, and 10 hertz. Then you can set that as your user program number 1, and then that will remain in memory for your, let's say, for example, it's your patellar tendonitis treatment. That's absolutely fine and held in memory for you. So that's the screens that you go through, the main screens that you go through with the EMS 560 Shockwave. But what I'll do now is actually go on to the actual treatment, where I'll be popping the, I'm going to just do a tennis elbow treatment here. I'm just going to get something to lean on so I can show you in a good view. As you remember earlier, I plugged in the 25mm. Let me just go through to the and unshare my screen. So we're back onto the big picture here. So I'm going to do a tennis elbow treatment where you can see my tennis elbow area here. I'm going to pop some gel on. I've already set the machine behind me to the treatment suggestion. So really, it's just a case of popping gel on the required area, holding the shockwave handpiece just loosely. So the actual pressure of it's quite a heavy handpiece. This is so the actual weight of the handpiece is just enough to just apply the correct pressure. There's no need to push or grip hard or anything like that. And I've got my foot switch down here. Traveling around doing the treatment in the elbow area. You can also hear there the fan will run on. There's no need to do all the shocks all at once. It's a good idea to just move around, see how the patient is. I think I'm okay, so I'll continue. As you can see, I'm just delivering the shock. And imagine that I delivered the required 2,000 shocks there. The fan will just run on just to pull down the handpiece. I'll just take that off there. And obviously, all during the treatment, you'll be sort of monitoring the feedback from the patient, because obviously, when you put that amount of energy into a patient that's quite painful anyway, they might have a chronic condition or a painful area. There's a good chance that when you do go over that area, you'll get some sort of a feedback from the patient that may be the tender spot for them. So obviously you're looking at moving around that area. You'll see a lot of indications where, say for example, Achilles tendonitis, where you might want to move all around the area rather than just focus on the actual focus point of the pain. You actually want blood flow around the whole area. So there we are. That's the actual treatment. After the treatment, it's quite normal for there to be, there is a little bit there, a little bit of reddening there, because you've actually instigated blood flow into an area that, you know, probably hasn't had blood flow. So the actual healing process, as Dinesh was talking about earlier, you're actually instigating that. So there are reactions sometimes with patients where they might feel that, I can feel that inside there now already just with a few hundred shocks, where the patient might feel it later in the day or the next morning. But obviously that is the healing process. That is the actual, is what is required from a shockwave treatment. We're not looking to cause too much pain for the patient, but obviously if you're using a radical treatment like this, it will be sore to a degree for the patient. And that's a quick potted demonstration of the EMS 560. As I said, there's a video as well to watch of the setup and treatment of this. And there you are, Dinesh. Maybe we can join in.
Yeah, sure.
To the questions and answers now.
Yeah, guys, I think we have received a number of questions from you in advance. So I think Roy, we strongly believe we kept those questions in mind while preparing the presentation. So most of them have been answered in this presentation.
Absolutely.
I think Roy is going to pull out some of the question and we'll go.
Yeah.
Yeah.
I think if we alternate, Dinesh, I've got one here from Harathai in Thailand, is how to release the heat on the handpiece after the end of treatment. Now you can see I just did the treatment there, and within the handpiece is a very small fan, and that is actually dissipating the heat during the treatment and will carry on after the treatment, dissipating heat and bringing the temperature down within the handpiece, because it is a mechanical process going on within the handpiece and it needs to be cooled. So that is obviously, it distracts a bit from my talking, I know, and carries on for a little bit. But as you can see, that is the releasing the heat on the handpiece, as Harathai in Thailand asked. And Dinesh, you have a question? Shall I read it out?
Yeah.
Dinesh, how effective is shockwave therapy in treating LBP and chronic pain? And that's from Anne in the Philippines.
Yeah, okay, I remember this question. So actually I did investigate about this, and it is very interesting because I could find a very interesting study which is done, it's a RCT done in Poland and published in Journal of Clinical Medicine in February 2020, which actually took two groups in 20 patients in group A and group B. Group A, which they did core stability training exercise and radial therapy, and group B, they took sham shockwave with core training and exercise therapy. The results have been very, very superior in terms of managing the pain, in generating better mobility as well as functional ability from the findings. So, you know, if you are interested to, please refer to this excellent paper which is published just in February this year.
Yeah. Thanks, Dinesh. And I have another one here for me. It's from Sarah, a vet physiotherapist in the UK, that asked, have we had experience using this on animals? Well, as Dinesh was explaining earlier, the electromagnetic version of delivering the shockwave is actually, it's just over a slightly longer time than the compressor driven. So each shock is just a slightly wider waveform. So it becomes more amenable to the patient during the treatment. It's the same amount of energy, but it's just done over a very slightly longer amount of time that makes it so. I have actually been on vet shockwave treatment courses, and so I've actually seen it being done on dogs for very similar problems to humans have, and also I've seen it done with horses with this electromagnetic version of delivering shockwave. And obviously, Sarah, I can send you more details afterwards. Got another question here for you, Dinesh. Any difference? This is from Elaine in Singapore. Oh. Any difference with the units, very local to you, Dinesh? Any difference with the units used by orthopedic doctors?
Okay, I guess I have actually explained, yes. If it depends which you are talking to, if it is focused shockwave and radial shockwave, nowadays, I think if I refer back to Singapore, I think they're using both of them. So, but I think important is to really understand difference between focus and radial shockwave, which I believe should have clarified by now. So next time, refer which one they are using, which one they are referring, that will make the sense. Thanks.
And the next one, I think we can both answer then. This is from Akanska in India. What is the difference between shockwave and shortwave energy? Well, I think we can see by the demonstration here, this is an energy that's going into the tissues by a shockwave, and mechanical action going in the handpiece, and the energy being dissipated into the tissues, whereas shortwave is actually airborne. It's actually being delivered into the tissues without contact, and it's being done by radio frequency.
And the effects are the physiological effects are very different, because shortwave we're more looking at thermal or subthermal level of physiological effects. Yeah.
Yes, yes. I think we've just about answered all of the pre.
So I think
we have time for that is.
as well. And
one more, I think here. It's I'll just ask this one.
Yeah.
It's from Karma in Bhutan. Potential harm and complications on patients. Are the shocks limited? Is there a way to refill them?
Well, as I mentioned, there's definitely wear and tear that is happening. So you have to change either the tubing or the applicator itself. So there is a wear and tear happening. Full effect, well, as long as you practice safe delivery, nothing is harmful. It's like using a knife. You can cut it, slice it, or you can kill it. So
yes.
It's very important. So yes, otherwise I think there has not been any major danger coming out of radial shockwave. Important is to avoid the area where there's too much of air, because air,
yes, lungs, yeah.
lungs
cavities,
or infections, infective states,
cancers, yeah,
inflammation, right? Yeah. So that's
absolutely.
Yeah.
And we're going to start wrapping this up now. I think we've just gone over the hour, but just a few questions that I've got here. Can you see them as well there, Dinesh? Okay. And we'll go through a few of them. Is your ESWT device Bluetooth capable? No, it isn't. You would need a physical cable because of the amount of energy that's required to deliver the shock. Would like to know more about treatment of ED. Unfortunately, we only deal in the MSK field. We have no experience in ED, but we do know that shockwave is used a lot with ED, erectile dysfunction. Have you got one of the questions there, Dinesh? You can.
No, I have gone through that, but I guess we may have to wrap up because we won't be, guys. We will be very happy to answer your questions because we're going to give.
Had one more question. It's on the cost of the machine. Obviously, last one. This is now okay, Dinesh. The cost of the machine. Well, it's obviously we manufacture in the UK and sell around the world, and obviously we will be sending you price information after the presentation. And that's from Stephen in the UK.
Okay.
Well, thank you so much.
Hang on, guys. I just have one, because in case you need to reach us, I'm going to give you the contact. We can run the poll as well. Before you guys all leave, second poll. I'm going to put this second poll for you to please feedback. And then I will flash the contacts. Am I audible? Just give me a moment. We are just going to launch the poll for you. Poll already? Okay. Yeah, okay. So next slide. Just give me a moment. Okay, guys, what's happening?
I have the poll, Dinesh. It's popped up on my screen.
Okay, great. Got it. So, guys, here we are actually sharing some resources for you. If you want to stay connected with us, we have this interesting EPA Facebook page that you can actually join us, and we will be putting some updates. I will also link up this session so you can access it. You can stay connected to the Physio Asia Academy on Facebook, listed here. Information on EMS device, you can look into the website or use this email to communicate. And below I am sharing our personal emails with Roy's, if you want to reach him, or myself. We'll be always happy to connect with you and answer any questions on this area. So I'll really appreciate you to give good feedback on the poll, that how you feel and how you want to take it in future as well. And please, again, feel free to write to us. You have all our contact. We'll be happy to answer any query. Roy.
Thank you very much, everybody, for participating. We really do appreciate you coming on here today. And I hope you learned something. Thank you, Dinesh, as well.
Thank you, Roy. Thank you for being with us. Thank you.
Thank you, everybody.
Good evening.
Enjoy your afternoon, evening.
Thanks. Bye-bye.
Everywhere, everybody.
It's true.